Hello, I'm Dr. Elizabeth Roy. Thank you very much for joining me. I would like to talk to you a little bit about a couple of new procedures that are phenomenal. Female and male sexual dysfunction, as you may know, is really a terrible thing. Sexual intimacy is so important to a relationship, to a solid family, to self-confidence, and so many men and women suffer. There are several different approaches. Certainly, sexual counseling is very, very important. There are different procedures for men, particularly, but very little for women available. Very few medications as well. I want to tell you about two procedures. One is called the O shot, and that is for women, and the other is the Priapus shot, and that's for men. I want to talk about them together because they're essentially the same procedure, just simply tailored to the gender. So what they are is utilization of platelet-rich plasma or a fibrin matrix. You may have heard of this procedure in the news recently. Kim Kardashian had the vampire facial. We're doing vampire face lifts and vampire breast lifts and all kinds of wonderful things with platelet-rich plasma. So it's becoming a very popular word in medicine in general and certainly medical aesthetics, and now overflowing into the sexual dysfunction specialty. Here it is in a nutshell. Platelet-rich plasma is produced from your blood. You come to the office, I draw your blood, I spin it in a little centrifuge. It takes about 5 to 9 minutes, depending upon the tube kit that I'm using, and then I inject it appropriately. If we're using it in facial aesthetics, I will either use a microneedling procedure and apply it topically, or I'll inject it right into areas that need restoration of volume or need rejuvenation. When we're talking about O shot and Priapus shot, we actually inject the plasma into um, the genitalia. So for women, for the O shot, there is one injection that is intravaginal and the other is around the clitoral area. For men, there are several injections into the penis, and I'll tell you, it's actually quite comfortable. We apply a topical anesthetic and wait a significant amount of time for that to work, and a very, very small gauge needle. Um, Very quick procedure and essentially painless. You know, there's a little bit of discomfort associated with injection in general, but there's no stinging, there's no burning, there's no after effect. And here's what the platelet-rich plasma does. It is specifically for rejuvenation of tissues. That's why it's used in dentistry, in orthopedics, and in aesthetics. Platelet-rich plasma contains growth factors and all kinds of healing elements that your body naturally makes. When we inject it strategically into the tissues of the vagina or the penis, we are stimulating stem cells that live there. What we're looking to do is stimulate new tissue, new nerve cells, new blood cells, or new vascular uh, tissue to that area. So it increases sensitivity, it decreases vaginal pain, it increases blood flow to the area, and it also helps to nourish the tissues intravaginally, also the tissues of the penis. So you can imagine that increased blood flow, increased nerve sensitivity, rejuvenation of tissues, all things necessary for appropriate orgasm, for appropriate sexual function. So although this is not magic by any means, it is an amazing procedure that the benefits have been phenomenal. And the risks are really zero. There is no harm that can be done with the platelet-rich plasma, certainly in the right hands. The injection technique, the placement of the plasma is really the key to the effectiveness. But very, very safe procedure, an excellent procedure to do for men with prostate cancer, for instance. Often prostate cancer uh, surgical type techniques will decrease a man's ability for sexual function, And the platelet-rich plasma, or the Priapus shot, has been found to be very effective and, again, very safe, an excellent way of approaching sexual dysfunction. In women, often there's pain with intercourse. There may be decreased sensitivity, especially after several children. There's a decrease in the tone, if you will, of the vaginal tissue. Also a decrease in clitoral sensitivity. This platelet-rich plasma made from your blood has phenomenal effects on all of those areas. And again, there is no risk to the procedure. I'm an anti-aging physician, and so I balance hormones all day long with bioidentical hormones. Certainly hormonal balance is an important part of sexual function, not only function, but primarily desire. So there are several strategies to improve libido, as well as actual physical sensitivity and orgasm and quality of orgasm. The Priapus shot will actually add to the size and the girth of the penile tissue, which is always desired, and also the strength of the erection and the quality of the sensitivity. That's what's most noted with most of my male patients. They're surprised at the increase in sensitivity. They're absolutely thrilled with the increase in size and the quality of the erection, but they're surprised by the increase in sensitivity. So both of these procedures are phenomenal, and I love doing them because they're effective and really quite simple. So please give me a call, drstudio.com, 561-444-7751. We'll make a consultation appointment for you, and we can discuss the specifics. Thank you.